Insulin resistance can exist for years before diabetes ever appears. During this stage, blood sugar tests may look completely normal. But how do you know if it is already happening in your body? In this video, we'll look at 3 important signs and tests that can help identify insulin resistance early. If you have insulin resistance, does that mean you're diabetic? The answer is not necessarily. Insulin resistance is usually an earlier stage of metabolic dysfunction. Normally, insulin allows glucose to enter cells, but when cells become resistant, the pancreas releases more insulin to compensate. For years, this extra insulin can keep blood sugar looking normal, even while metabolic stress is building. Diabetes develops later, when the pancreas can no longer maintain this compensation and blood sugar finally begins to rise. So, can insulin resistance show signs even without a blood test? In some cases, yes. One example is acanthosis nigricans, dark, velvety patches of skin that often appear on the back of the neck, under the arms, or sometimes over the knuckles. These skin changes are associated with high circulating insulin, stimulating skin cell growth. Another possible clue is the appearance of multiple skin tags, especially around the neck or chest. Skin tags can occur for several reasons, but a sudden increase may sometimes reflect elevated insulin levels. A third useful indicator is the waist to height ratio. If the waist measurement is greater than half of a person's height, it may suggest excess visceral fat around internal organs, which is strongly linked to insulin resistance. But it's important to remember, these are clues, not a diagnosis. Now, how can insulin resistance be detected with blood tests? Routine health screenings usually measure fasting glucose or hemoglobin A1C or HbA1c. However, these markers often change later in the process. To detect insulin resistance earlier, doctors may measure fasting insulin along with fasting glucose. Using these two numbers, we can estimate something called the HOMA IR Score, which stands for Homeostatic Model Assessment of Insulin Resistance. The formula is simple: fasting glucose multiplied by fasting insulin divided by 405. In many clinical studies, a value above roughly 2 to 2.5 suggests insulin resistance may be present, even if blood sugar still appears normal. This helps identify insulin resistance years before diabetes develops. If this explanation helped you understand it more clearly, feel free to share your thoughts in the comments, and consider subscribing for more simple explanations about health and medicines.